Welcome back to Get Your Man On. If you have a question for us or need to get something off your chest, leave a secret confession, maybe about your sex life for the world to hear, go to getyourmanon.com, click the button, and give it to us. We've been talking about erectile dysfunction, the various treatments for it, and we need to absolutely give some time here to testosterone. Testosterone is a hormone that is produced in all men. It is very hot right now. And when you talk about testosterone, you immediately think of what? Bodybuilders, the big burly guys who are jacked, they're lifting massive weights. You think about roid rage. You think about guys going crazy from testosterone. And to be honest, it's just a normal part of male biology. And when you start introducing massive amounts of it, yeah, you're going to get some roid rage. You're going to get some serious side effects. We end up dealing with those kind of side effects all the time in the clinic. Poor guys see it all the time. Guy comes in and at 60 years old, took steroids when he was in his 20s, and he has erectile dysfunction. He feels like crap, and he needs treatment for just about everything. His hormones are all screwed up. So we want to talk about testosterone and doing it the right way, doing it the correct medically prescribed way, in a way that is healthy. It is primarily produced in the male testes, right? And it can be a massive, massive help to guys as they age to have it replaced. Hormone TRT, testosterone replacement therapy, HRT, hormone replacement therapy. You can hear it called many different things. But from the time men are in their teenage years, it starts playing a critical role in developing the male sexual characteristics like muscle mass, body hair, regulation of sex drive and fertility. It regulates your mood. It helps your bones. It can do all kinds of things for you. And you're gonna have a lot in those teenage years as your body is becoming a man. It's making you into the guy you're supposed to be. And, through early adulthood, it's going to be just pumping it out for you. Now, studies have shown that testosterone in men has dramatically decreased. A guy who's 20 today has the same testosterone as a guy who's 70 20 years ago, which is crazy. And I see it all the time. Guys come in and they are in their 60s or 70s, and they have higher testosterone than guys in their 20s and 30s. Lots of reasons for that. But basically, at about age 30, it starts declining at about 1% per year. And so you're going to end up with low testosterone at some point in your life. But now guys are entering into adulthood with lower testosterone. It's affecting their erectile function. Testosterone does have sort of this ancillary benefit of helping erections, helping you get turned on. Sex drive is a huge, huge motivator. And more we see, 20, 30-year-olds coming in and just being like, I'm just not in the mood. They don't feel sexual. They don't feel attracted to anything. They just are kind of like blah. And you hate to see that. And oftentimes, you want to rule out some other factors, especially the younger they are. You don't want to necessarily give a guy who's 18 testosterone replacement therapy. But I had a guy come in one time, and he was, he looked like a pencil. Every appendage looked like a pencil. I don't know that I've ever seen such a skinny man. And he was lanky, tall, probably 6'3", really nice guy, like soft-spoken, and sat down with him. He's like, Evan, I just don't feel like a man. He's like, I just don't feel like I have sex drive. I've tried to go to the gym. I feel like everyone's staring at me because I look like Gumby. He didn't look like Gumby, but I was just like, oh man, I'm so sorry. We tested his testosterone. It was 80, right? Our clinic, we want to see guys between 700 and 900, right? That's optimized range. That's like, not great. And so we gave him testosterone. I didn't see him. He came in the clinic. He was getting his weekly shots. He was getting his blood draw. It was like 8 or 9 months later. I just happened to be sitting at the front desk. He comes in and I didn't recognize him. I was like, hey, sir, can I help you? He's like, Evan. I was like, hey, oh my gosh, Josh, what? And this guy had, he had turned into a new man. It was like this guy never really went through puberty. It was crazy. So we gave him this testosterone. He was 40 years old. I mean, he wasn't he wasn't young. He was 40. I mean, I'm sorry, I'm 40. He was very young, 40-year-old, extremely young, vibrant. 40 is not old at all. I can't, anyway. So he looked completely different. He had biceps. He had chest muscles. He had facial hair. He said, I can grow a beard. I was like, really? That's an amazing side effect. And he was like, his voice was actually deeper. It was like this man had gone through puberty in a matter of, less than a year. It was quite dramatic. And those results are different for everyone. Because of, you get testosterone, then a lot of it has to do with what you do once you get that testosterone shot. Do you just go back to laying on the couch, or do you start getting into the gym? Do you start lifting heavy? I always tell guys you should do weight training, and that will both increase your muscle mass and shred some fat. And the changes can be dramatic really quickly with that. I'm always fighting with guys over, well, I just like doing my cardio. And I'm like, well, how are you going to grow muscles if you're just doing cardio? Do some weight training safely. Do it safely. But this guy, Josh, had applied himself. He went out, started eating really healthy, got in the gym 3 times a week. It wasn't even like he was going every day, but he was taking a weekly injection of testosterone. At 100 milligrams a week, no crazy bodybuilder dose. They take sometimes like 1,500, and it changed his life. And he just was smiling, and he had a girlfriend, and he just was I just get over here, man. I gave him a hug. I was like, I'm so happy for you. This guy was just thrilled to see his life change dramatically. And again, this is an extreme example. I've seen that happen multiple times where guys they use the testosterone to just go for it, just get in the gym. They change their diet. They start, treating their bodies the way our bodies were intended to be treated, with respect, and it just absolutely can be huge. There's side effects with testosterone, of course, and most of the side effects I see with testosterone are when they're overdosing. To be honest, I mean, I need to talk about blood thickening. One thing I tell guys all the time is make sure you're drinking plenty of water. You don't want to do that. I don't see that often, but if you're dehydrated, it's gonna testosterone can increase your blood, your red blood cell count. You can, if you're prone to hair loss, it's going to it can maybe speed up that hair loss. It can cause there's a bunch of studies out there showing some stroke and things like that can be associated with it. Again, I've never seen that, but just that's some of the side effects that are associated with it. We'll talk a little bit more about those side effects here in a second, but I just want you to know that you should get tested if you think you're low, and if you have ED, you should know your testosterone numbers as well, and see if that maybe could be an ancillary effect. Because a lot of guys are like, yeah, I can't get it up. And I'm like, well, are you in the mood? And they're like, well, not really. And I like, well, hey, sex drive is a big deal when it comes to, being able to get it up. And we 100% want to get you where you're able to perform. I mean, it's a big deal for everyone. And it's a big deal for relationships. And so testosterone, go get your numbers tested, check them out, see what's going on with that. And I just want to read over the side effects just to be clear, and talk about with the provider. I don't want to scare you away, because again, I don't see these things hardly ever. But it can develop, some prostate cancer. Like I said, the strokes, blood clots, heart attacks, high blood pressure, cardiovascular problems, causing tissue edema, causing changes in lipids, testicular atrophy, causing infertility, developing breast tissue, similar in appearance to that found in a woman, causing head hair loss, causing permanent hair growth on one's face, chest, buttocks, or other areas on the body, and developing psychological changes such as increased anger or aggressive behavior. But if you treat it correctly, that the likelihood of that stuff happening is very, very low. Almost every single one of those, I think, is related to how when you take too much of it. And so if you take appropriate prescribed amount and you get tested frequently, you're going to be able to handle that stuff. You're going to be able to manage it. I want you optimized, want you healthy, want you happy, want you rocking and rolling. You deserve to be the best man you can be for yourself and everyone that's around you. All right, go to getyourmanon.com. On the next segment, we're going to be taking your call and answering